Action.
Okay. All right. So as I was looking through my patient's orders, I noticed that a Foley catheter has been ordered by the doctor for my patient. I'm going to enter the patient's room, wash my hands. Excuse me. I'm going to provide privacy because obviously this is a very touchy subject, or a very sensitive subject for many people. I'm going to enter the room. I'm going to identify the patient by two identifiers. This is Sally Sue Johnson. She's 34 years old. I look at her name band and it tells me that. And so I'm just going to explain to her that Miss Johnson, the reason why I'm in here, so my name is Megan Cox. I'm going to be your nurse today. The doctor has ordered a Foley catheter to be placed because he's worried about your urine output. So what I'm going to do is I'm going to enter a small tube, it's called a Foley, into your urethra. It will go into your bladder, and there all of the urine in your bladder will drain directly into the tube and into a little bag at your bedside so that we can keep track of your urine output. And at this point she'll probably say, oh, I don't want one. Again, just teach her and tell her that this is a doctor's order. So I washed my hands. What I'm going to do first is, again, this is a very sensitive area, so I'm going to provide as much privacy as possible while still being professional and getting my job done. So I'm only going to uncover as much as I need right now to provide privacy. I'm going to don a clean pair of gloves. And I'm going to grab a wipe. And I'm just going to clean the area. Again, only using one wipe, one side, getting a new side every time, making sure everything's clean. Spreading the labia, cleaning inside in preparation for the Foley catheter. Okay, so once that's over, I'm going to change my gloves. I don't need those right at this moment. And I'm just going to clear off my bedside table so that it's with me here. So we'll just put this over here. I will need these again in a second, so I'll just put them at the bedside. I'm going to prepare her by spreading her legs a little bit. And again, just teaching her what I'm doing and telling her what I'm doing the entire time as I'm going through this. Providing as much privacy as possible. So then I'm going to open up my Foley catheter kit. I'm going to be using this as my trash. I'm going to get that and set that right there. And I'm going to position this so that I'm never turning my back on it. I'm always where I'm supposed to be. So I'm going to throw this away. And then this is something that I would put my name, the date of insertion, either per facility policy, so either on the Foley catheter itself or in the patient's chart. So we'll just set that aside. I'm going to begin by unwrapping my sterile field. Again, keeping a 1-inch margin. Oop. Like that. At this point, I'm going to grab my gloves, being careful not to touch anything else in my kit. I'm going to put those right here on the side. I'm going to move that just a little bit. Again, once I open this, I have a 1-inch margin. maintain my sterile fills. Put my gloves on. Maybe touching the inside of my gloves so as to not contaminate. I got 2 fingers. Going to adjust, and because this is sterile still in the middle, I can take this and I can remove it, throw that back behind me. Keeping my, I would not have done that because I put my hand below. So because of that, I wrote sterile filled. I will replace my gloves. Hopefully, hair. Before we get through that, and then going through all of the steps that I talked about before. Making sure not to touch anything. I'll just go like that this time. Now I can move this over. I can prepare my field. So I'm going to take this. I'm going to put shiny side down. I'm going to roll it in my hands so that I keep my hands sterile. To put it under, making sure that my gloves don't touch anything. And then this is not my area where I can put the box down if I choose. I'm going to take my second drape, being careful not to let it touch anything. And again, this is just to provide a sterile field and some privacy for the patient. Okay, next I'm just going to prepare all of my things. Being careful that I always try and go from the sides and never reaching over it as much as possible. I'm gonna grab my lube, open that up just a little bit. Again, making sure that I keep my hands above my waist at all times. I'm going to prepare this so that once I begin the actual insertion process, then I don't have to worry about anything. So this is all sterile, so I can just put this right into here. Put that over there. Insert that there. Just as an extra prevention measure, I'm going to put the tip of my Foley directly into the lube. This just again helps aid in the prevention of contamination. So when I begin, this is going to be my dirty hand, this is going to be my clean hand. I'm going to come and I'm going to spread the labia as much as I can. I'm going to take one wipe down away from me. Wipe down towards me. And then wipe straight down the middle. And then I'm going to bring my box over, place it right here, making sure that everything stays sterile. At this point, I'm going to tell my patient that I'm going to be entering the Foley catheter into your urethra now. When I do so, please bear down, as if you were going to the bathroom normally. So So I'm going to come up. I'm going to take that off. And then I'm going to take this. I'm going to insert it into my patient. And I would go until I see urine return. And then I would advance it 2 more inches. At which point, according to this Foley, I insert 5 milliliters of solution into the balloon. So I would do that at this time. And then I would disconnect that. 5 milliliters. And then I would disconnect that. And then I would just pull on this to see the return. It is snug at this time. And so then, if we were to be getting a UA on this patient, I would then take, most kits come with this, or you can get one at your, or they have other specimen cups. You would take this, and with your bag, because this is all sterile, this has not been exposed to any bacteria, you would take it and hang it at the bedside for normal drainage. For a UA, we would take this, and once we have urine return, clean the end of the spout with an alcohol wipe. Open this, making sure that our cap doesn't fall to the ground like that. If that were to happen, I would get a new one, but making sure that I place the cap so that it doesn't get any contamination on it. I would empty the urine into the cup, label it, send it immediately to the lab. If this was longer, and this is for if the Foley has been placed for less than 30 minutes. If it's been longer than 30 minutes, then I would take a 10 milliliter syringe with some alcohol wipes, wipe this down, and then wait for it to dry. And then I would clamp this, withdraw my 10 milliliters of fluid, or however much fluid I need, usually about 10 milliliters. And then, again, same process, put it in the sterile specimen cup, take it to the lab, and just like that. So we would hang this on the actual frame of the bed. You never want to put it on the side rails because they can get messed with. And we never want the Foley bag to be lower than, or we never want the Foley bag to be higher than the bladder. So by keeping it on the bed frame, it just helps with that. So now I would clean up my area, ask the patient if there's any significant like pain or discomfort, inform her that yes, it is going to be uncomfortable, but just be talking to her, have an open conversation with her. Clean up all of my stuff, or I would put new gloves on, clean up all of my stuff. And then for the Foley removal, where this is not a sterile procedure, all I need is a fresh pair of gloves. So I would check the doctor's orders. The doctor has ordered that she does not need her Foley anymore. So happy day. So I would come in again, introduce myself to the patient, say the doctor's orders are that we need to take your Foley out now. I would check, make sure that she's Miss Sally Sue Johnson. She's 34 years old, matches her name tag, that way. I would apply a new set of gloves and lay my syringe.
Is it in your box?
No, it's not in there. Okay. We'll just talk through it and know that I have the appropriate syringe for this, because in this case I would not have the syringe that comes with the kit. I would go get one from the nurse's station, just an empty syringe that I could use for this. So I would take it, I would relieve, I would pull off however much fluid is in there, plus a little bit more, just to make sure that we get all of the residual fluid out of there. So I could anticipate pulling anywhere from like 5 to 6 milliliters of fluid, depending. And so then, again, I would say, I'm really sorry, this is going to be a little bit uncomfortable, but I would have her bear down as if she were going to go to the bathroom, and then we would just, well, that's actually going to be stuck. Okay, we're actually going to, can you pause it?
Sure.
Is there a pause button?
Yes, there's a pause. Action.
Okay, so I have my 5 milliliter syringe. I'm going to insert it. I'm going to pull off my fluid. And then I'm going to disconnect it. Then I'm going to pull this out. Throw all of this away. Make sure that if there's any residual that it's emptied out and it's counted for her eyes and nose. At this point, I would get some fresh baby wipes and I would just wipe her down and clean it because the area is going to be irritated, and you just want to make sure that everything's clean down there because we don't want to risk a UTI or a hospital-acquired infection, because that would not only be harmful for our patient, but it would look not great on the hospital either. So at this point, I'm going to return her, provide privacy, and then I'm just, throughout this entire process, I've been documenting my findings. So when I placed the Foley, when I got my UA sample, either the 30 minutes or 30 minutes before, after insertion, or after when I grabbed it from the port, I would just make sure to document all of that and document any abnormal findings that I found. And then I would return the patient to a comfortable height if this bed worked.